so happy to be here with you, Dr. Sam. I'm going to introduce you, and then I have to give a little bit of background. I remember the day I met you, we were all it was at the Women's Summit for the World Trade Center Institute in Baltimore 2 summers ago. It's crazy, my gosh, how time has flown, and I'm sure so much life has happened for you too. I just remember it was me there in my dress and my blazer, and Lindsay from Johns Hopkins there in her black suit and pearls, and you looked like you were about to go to a wine tasting lunch in Malibu, and Dr. Sam just has the most gorgeous style. Let me introduce you. So this is Dr. Samantha DuFlo, DPT, PRPC, RRCA. She is a doctor of physical therapy who has achieved the highest level of pelvic health board equivalent certification and founder of the East Coast's largest pelvic health practice, right? She's the author of Pelvic Prep School. I love that. I feel like we should all be taking Pelvic Prep School. It's a course and a book containing essential pelvic health information. Dr. Sam is also a running coach, a professor, a director on boards, and a mom. Not least important of all of these. So it's true. We were at this summit and you were just I'm now living in California, but you seemed very Californian to me. You're so beautiful. And you just I love that you, following you on social media, I can see that you're so physically active in your own life. And I'm really excited to talk about how that fits in with pelvic health. And I guess, I'll first share, I'll share with you something that has had me really, really curious. And I would love to get your thoughts on it is, I was self-employed. I was ghostwriting for a good decade plus, which, it was, that was a nice life. I would write with a lot of focus for 3, 4, maximum 5 hours a day. And then I could be out living my life, being super active. I wasn't married yet. And then 5 years ago in 2020, it so happened I turned 40, right before my birthday's December 21st. So right before the start of 2020, I had turned 40. And I also I went back to work full time at the very beginning of 2020. And I was still taking book projects. I was living the most sedentary life. And it's been really, really hard for me, for somebody who used to teach fitness classes. And I have noticed in this phase of life, moving into my 40s, which has, I'm 45 now, they're already flying so fast, but I'm the pelvic floor is something that I'm just a lot more aware of than I used to be. And I'm going to overshare, as I sometimes do as a health editor. I just noticed changes in the pattern of how often I was needing to pee, and things like that. And I guess I'm really glad, I want to, I feel like pelvic health is a little bit like the topic of fertility or the topic of menopause. We don't really necessarily think about preparing for it or being preventative about it until we're in the midst of a problem. Which is one of the reasons that I love Pelvic Prep School. I think that's such a great name. Can you describe for us, Dr. Sam, what is the pelvic floor? And would you agree, are we talking about it more culturally? Is it just that, I live in an echo chamber sometimes, I feel is it just because I'm thinking about it for myself? Okay.
I think it's both. So thank you for the lovely introduction. I really appreciate that. I think in my past life, or a future life, maybe I'll be a stylist, but that's really my jam.
Yeah.
And I am very active. And I think a lot of that's driven, I grew up in upstate New York. So, with a very active dad. And so we were always out doing something, usually chores. Now it's channeled into a different energy now. But as a founder and somebody who's operated a business for so long in the past, I needed that outlet of running and other things to keep myself mentally healthy.
I get that.
That's and there's so much research to show that. And unfortunately, post COVID, although people are getting standing desks and walking desks, and they are, home and have more time to carve out for exercising, and people have, spin bikes and treadmills and things like that at home. The life of Zoom lends to a lot of sitting and being sedentary versus like bopping around an office or walking into an office and going out for meetings and things like that. So things have really changed. And I agree with you. When I founded my business that I've now exited, for venture capital and private equity, 10 years ago, no one was talking about this, or it was very minimal. And people had approached me and said, like, this is a great idea, but no one's going to pay for this service. No one's going to come to pelvic floor PT. And I was bursting at the seams. And so, 10 years later, we had 7 locations, and clearly needing this service and continue to need this service. But we're talking about it more. And some of that is that there are a lot of celebrities that are, once they hit menopause or perimenopause, they really start amplifying the voice of this. So Naomi Watts, Stacey London, I mean, I could go on and on. There's so many of them that are really investing in perimenopause, menopause, highlighting the issues. There's a lot of also, thank you to social media and celebrities, there's just a lot more awareness now, from endometriosis to prenatal, postpartum, things that can go right, things that can go wrong, and people are starting to talk about it. And what I really appreciate about that is that it used to be this joke of like, oh, I pee my pants a little bit, I had a kid. Or I'm in like perimenopause, like entering menopause, things are just like not going how I thought, like LOL. And now that that dialogue is changing a lot, reflect that those things can be treated. Women are over 50% of the population. We deserve that health care, and people are seeking that credible information. With that is the parallel of influencers are not always experts, and sometimes we have to dispel misinformation. But as you know, as somebody who works in publications, we have to really thread through what's true and what's just common, what's everyone saying versus what's really evidence-based. And it's not just like a case study.
We're going to talk about that. That's one of my questions for you as we go through this conversation together. I don't even know this myself. That's embarrassing. I shouldn't say that. But what exactly comprises the pelvic floor?
So the pelvic floor it's also referred to as the pelvic diaphragm because it moves much like our breathing diaphragm does. And the two work. So your breath diaphragm is underneath your lungs and attached to like your rib cage, and that moves up and down with breath. But with that, your pelvic floor also moves up and down with your breath and movement. So they kind of works together like a pistoning system. And so your pelvic floor is, there's essentially your pelvis, which is comprised of several bones. You have your sacrum, your tailbone, your two ilium, ischium, and pubic bones. And then you have these 3 layers of muscles that are at the bottom of that. And the external layer, or what we call is like the most superficial layer or the first layer, is most commonly known to folks. That's what's in your labia, it's perineum, your anal rectal area. It's kind of what you can see. That's more for sexual appreciation, to control the sphincters. And then when you get to these 2 deeper layers of muscles, they're really there to support the bladder, the uterus or the prostate gland, and the rectum. So there's no way to differentiate. Like when people say, well, I'm doing Kegels or pelvic floor contractions, when you contract, you're not just contracting the vulvar area, it's the whole anal rectal area too. It's all comprised
That's
into
so
one
interesting.
system. And that's to provide you with a lot of support. And obviously, that support changes as we are aging and going through menopause and losing some estrogen, as somebody is pregnant and, taking on their center of mass and center of gravity is like changing a lot, as well as other physiological changes that happen in our
very
lifetime.
shortly to get into some questions around like trends that you're seeing in clinic. But I want to ask you first kind of about your personal story into this. How did you discover that like this, you seem like one of those people, like it seems like a calling for you. Would you say that's true? And
I feel like in general, women's health is a calling for me, or underserved health populations, because I want to be inclusive of BIPOC and trans folks, because like that is a very underserved niche in pelvic health that needs more care. But it is. I sort of happened upon it accidentally. I had gotten into distance running, as most people do. They get into physical therapy as a profession. I'd gotten injured. I saw a great PT, and he was like, this is all just physics. And my mind kind of like exploded. And I was like, I love this physics. I love the biomechanics of this. So when I originally started at the School of Medicine, my intention was to work in some kind of sports orthopedics and try to really focus on female runners. And I had also simultaneously have a very strong interest in public health. I've traveled all over the world to developing countries. I've done volunteer work. And during my doctorate program, I lived in Malawi, which is in sub-Saharan Africa. And I did HIV/AIDS research and needs assessments in the rural childbirth system. I don't even want to call it like a delivery unit, because it was much more scaled back than that, I guess is the right word. So I got really interested in women's health because Chrissy, like, listen, if you hurt your knee, you can go and wear crutches and use crutches and limp. You can ask for help. You can say, I need help in the grocery store. I need help at home. Like, this is painful. But if you have chronic severe pelvic pain, whether it's caused by pelvic floor dysfunction, endometriosis, etc., that is not something 10 years ago, especially, that we just sit at the lunch table and discuss. There was so much shame and stigma that surrounded that. So I felt like intrinsically there was so much more that I could do for this population that needed to be served. And then I'm self-motivated too, because I am more of an introvert. And this gave me an opportunity to work closely with a client one-on-one for an hour and really help them flourish in their healing process and their care, versus seeing clients for like 20, 25 minutes and just seeing, 22 people in a day. So it really served my needs and how I could be a best practitioner and spokesperson for this population in many ways, kind of a self-selected or non-nominated spokesperson. And then also looking at, there was not a lot of people doing this, or people were like starting to enter the field. There are some like really strong founders of pelvic physical therapy, but there wasn't a lot of research back then. And so I kind of slipped into this role, and there wasn't anywhere for me to really work. I had worked in a hospital practice doing some pelvic floor PT and alternating with orthopedic. And I had worked in an outpatient practice, but nothing was really fitting the paradigm of how I really wanted to treat and the clients that I wanted to treat. And so I had to create it. And now we're really lucky because there's so many different options for folks.
It has the really field has sort of exploded. What kind of conditions, I mean, over the years, or I'm curious, perhaps like most recently, and is there a contrast between like what maybe you were seeing several years ago versus what you're seeing now? What are some of the complaints that are bringing patients in the most?
I think it's not that the dysfunction or pathologies that people have are changing. Like, I can't make a plausible causation of like, well, now we see more of this because it's abundant.
Yes.
I think it's that the awareness has increased. So before, women were not getting diagnosed with endometriosis, or they were just, they were being told to get a hysterectomy or cauterizations or other failed treatments. And now most medical practitioners that are seeing a client with endometriosis are saying, like, you need to go to pelvic floor physical therapy in conjunction to how we're treating you medically. And so we see a lot more folks with things like that. And then I also think that there's been kind of two really big awakenings. One is, three, there's multiple. But one is in the perinatal world, people don't want to live with a C-section scar that's tight and uncomfortable and pulling in. They don't want to live with, post a tear. People are really trying to avoid tearing or receiving an episiotomy. And so they want to be very proactive about that and those things and returning to healing postpartum. And then also in the world of perimenopause and menopause, people are like, I don't want to be like the older generations wearing a panty liner every single day. I don't want to have prolapse. And so now that there's more information out there, whereas I think before we used to see more folks that had more dramatic incontinence and significant pelvic pain, that now we see a much wider variety of individuals with less severity, because they're like, oh, I have a little bit of leaking, or my urgency has increased, or I'm pregnant and I really want to prepare myself best. And this is what I read that needed to happen.
How do you know, or I guess like trying to think how to ask this. Like, I have someone in my life, a loved one, who recently experienced a prolapse and, is not a clinical person and really panicked, was afraid this was cancer or something. And thank God it was kind of like, then she goes in, sees the doc, her PCP refers her, and they're like, oh no, this is like a laparoscopy procedure. This is pretty, maybe that's not what it was, but, pretty easy to address. I feel like, when does someone know that it's time to bring it up to maybe their PCP? Or like for me, I was kind of just living with what I thought. I'm like, oh, I got an overactive bladder. I'm 40 now. Like, when do you bring it up, I guess?
As soon as you see symptoms. I would say everyone has a pelvic floor. Doesn't matter your gender, sexuality, everyone has one. And it's all tied together. So incontinence, constipation, sexual dysfunction, decrease in ability to orgasm hyperactivity. There's this like big spectrum of things that occur. And as soon as you start feeling those symptoms, that's when I would go to a pelvic PT. And many states now allow direct access.
You don't even need a
have
referral.
To go through your PCP.
That's such valuable information. Wow. Okay. Because I for sure would have thought like you need a referral.
No, we're just like a regular, we code and bill the same as a regular physical therapist. Pelvic PTs usually spend 45 minutes to an hour with their clients. And so they're one-on-one in a private treatment room because of the nature of what we do. But like, we as women, Chrissy, like, we should be thinking about, all right, I'm thinking about having a baby. I should go to pelvic floor PT. I had a baby. I should go to pelvic floor PT. I'm having really disruptive menstrual cycles. I'm missing work. I'm feeling so sick. There's also, as soon as you kind of start feeling that symptomatic of perimenopause, like brain fog, disruption in sleeping, change in how your body fat's positioned in your body, different things like that, we should be saying, all right, it's time just like you would go to an annual with your GYN. It's kind of like, I need to check in, and before things kind of ring the alarm bell, like, oh, I have a prolapse, let's check things out, because most people are doing Kegels wrong, and they're not activating their pelvic floor like they think they should, Also, bagels are not the answer to everything. A lot of people have leaking or incontinence of various kinds or pelvic pain because they're too tight. Because listen, like you say, you're sitting all the time, you're sedentary. That doesn't necessarily equate to weakness. Sometimes that means that you're like glute clenching, you're like stressed out. And so you're holding all this tension. And so it's not just like, oh yeah, I'm leaking a little, I should do 100 kegels a day. That can make things worse in some instances. So sometimes you just got to go and just be like, I'm just here for like a visit. I just want to like check things out. Am I as strong as I should be? You know, it's not that, oh, you turn 45 or 50 and you just like fall off a ledge. We want to make sure that we're keeping things the way that we want them to, so that we can continue to be as healthy and active as we can. Because the thing about it, Chrissy, is once you have, pelvic organ prolapse is graded in, several different stages, and it's like how far it's dropped. And typically we'll get the like panic call of, oh my gosh, I can see it. Like I'm freaking out. Like what's happening? I will say like the biggest week for that, it's not funny, but it is funny, is right around college move-in time, because we've got these perimenopausal and menopausal women that are like hefting these giant totes upstairs and their kids into college. And all of a sudden it's like, they feel this. And so once it's a certain grade, now the earlier stages, evidence shows that pelvic floor PT is the best to control and try to lessen that and increase the support of the pelvic floor to that organ. But once you're really far into the grade and it's dropped much lower, then you still want to do pelvic floor PT to strengthen those muscles so it doesn't happen to other parts, etc. But then you're more of a surgical candidate, or using something called a pessary, which is something that you insert. It's kind of like what we would consider like an old school diaphragm, although it's not preventative in any way. It's not a contraceptive, to kind of hold that up and support it. So what we want is to say, like you said, instead of waiting for the fire to get the fire hose out, let's just go a little bit before and say, like, I know my body's undergoing changes. Estrogen is what helps to keep those muscles in the pelvic floor and the vulvovaginal area really strong and lush. I'm not using them as much. I'm a little bit more sedentary. Maybe I'm not as sexually active. Maybe I'm way more sexually active than I was before. And, I just want to get a checkup and kind of say, like, where am I and what can I do to prevent some of these things happening?
I'm glad that you brought up estrogen. I want to chat about that a little bit because, oh my gosh, I mean, there's just we just need to be really, really clear. And there's such a part of me, maybe because I'm in a phase of life where like we're still building our family. I always say, like, I met my husband later in life than I really wanted to. And then we met, and then a lot of life happened, and we didn't really get to focus on like this beautiful chapter together until pretty recently. So I really I have a dear friend who, one of my closest friends from my New York years, and she's actually going to be on the next episode, but she's, like a holistic nutritionist, and she's studied a lot around hormone health. And when like, I tell her, please don't talk about perimenopause with me, but the fact that like, cause I don't want to think about that. I'm trying to have a baby. I don't want to think about like, oh my God, I'm entering menopause soon. Like I kind of just have to put that out of my head, and thank God my anti-malarian hormone is
Chrissy, perimenopause.
So you're saying I shouldn't panic and be like, because I mean, my cycle's still super regular and stuff. So, but there's, and
that's the cycle's one indicator. There's a huge roster of things that change. And now with the improvement in hormone replacement therapy, which, is for certain, not everyone can take it, but certain candidates can, external topical creams. There's so many different things that we can do, but estrogen is kind of the jefe, the boss, the like, it it's our best friend and our frenemy at the same time.
I learned kind of,
but
thank you. Thank you. I'm not panicking yet. I kind of refuse to panic. We're just going to enjoy summer. But, after my first pregnancy loss, a couple years ago, we learned that, it may have been because I needed to take misoprostol for it. It was a missed miscarriage, and, my uterine lining was really, really thin after that. So I supplemented with, this was interesting, and I'm going to share. I'm sorry to overshare, listeners, but I also just for the sake,
I don't know.
Right. So, but for the sake of education, my doctor was like, I'm going to put you on, there are these, if you've taken them, there are these little blue pills, the little estrogen. And then as she was getting ready to walk out of the room, she goes, you know what? Take them vaginally. And I was like, oh, interesting, and she said, you're going to get it filled there. It says take them orally, but just take the same dose vaginally. And within 7 days, for anybody who's going through fertility stuff, if you've had a thin endometrium, I took that. And then I took, oral vitamin E, and within 7 days I had tripled the thickness of my endometrium. But in passing, I said to my doctor, I was like, within that week, I was like, you know what? I haven't been running to the bathroom as much at night. She's like, oh yeah, estrogen helps that. And I was like, oh, there's an actual effect. I thought I was just imagining it or something. So can you talk? I'm really glad that you explain kind of the mechanism behind that. So the estrogen has to do with the inherent muscle strength.
Yes. And so estrogen works in many different ways in the body. It physiologically affects us, everything from eyesight to if you're developing vertigo, your brain, just so many different things. But I kind of imagine it that if your pelvic floor is a forest, then estrogen is what likes to keep it leafy and green. And without estrogen, it kind of becomes a little bit more like winter. And so so estrogen helps improve blood flow, and blood flow brings all the good stuff, all the good nutrients. Your muscles need good blood flow to activate, to operate. Estrogen helps with your sex drive. It helps with your muscles feeling lush and abundant, which is why as you age and folks that don't take hormone replacement therapy or topicals, you start to get some thinning of tissues. That just doesn't happen at the vulvar area. We lose muscle mass all over our body, but it does a lot to help keep that area lush and abundant, I should say. And that doesn't mean that there aren't other ways, right? Now, especially, there's so many more improvements coming along down the highway for treating women going through perimenopause and menopause in the world of women's health and innovation. But, activity, exercise helps your pelvic floor, sexual activity, there's a lot of different things because those are bringing blood flow to the area. You're working a muscle, etc. However, estrogen is really important, and there's a lot of different causes to one thing. So you can't say I'm incontinent or I have an overactive bladder. It must be estrogen. It could be weakness. It could be tightness. It could be your diet. It could be that you're constipated. That can cause leaking and incontinence. It could be that you're heavy weightlifting and not using your breath correctly, and you're causing a lot of pressure to be put on your pelvic floor. And this is what the job of a pelvic PT is to kind of thread those different things out and say okay, well, I think you need to talk to your doctor about potentially getting a topical estrogen cream if you're a good candidate for it. We can't prescribe those things. We refer you out for that. But also we need to do some strengthening. And then we got to work on how you're lifting on your everyday basis because you're putting a lot of pressure down there.
Can you talk? I want to really set the stage for someone who's listening to this episode and they're like, oh, I've needed this and I didn't even really know it. next question, I think for so many of us, I know it's one for me, is like, I know you can't speak to, you're not, part of CMS, but like, what does the payer, is it cash? Like, what should people expect? And then what kind of modalities, like what is the work together like between you and the patient? Am I lying down? Am I, I feel like I've seen in some of my research, and it's honestly a question that I have, like, I think I saw like there was some kind of wand that was used, perhaps. I'm not sure. I could be wrong, but I was like, and I'm like,
Okay,
I really like,
so let's
this
talk
has
about
to be
this.
somebody that I really click with, like for me to undergo that,
When you go through your doctor of physical therapy program, there's not a huge emphasis. You might get a few hours or a day on women's health and pelvic floor PT and perinatal care. It's really such a specialty and niche. And there's a continuum. When you're first learning pelvic floor PT out in continuing education, you learn how to do a lot of strengthening and Kegels and how like your hips and core work together to like help strengthen those. And then as you get down the line, you get more specialized and really go into this in-depth stuff. There are many different kinds of pelvic physical therapists. What I work with and how I work is I see my clients for an hour, one-on-one in a private treatment room. And so this includes looking at somebody very holistically, because you could have perineal pain and we could treat the tension, but if you're hypermobile in your ankles and you keep turning your ankle in over and over again, and you're getting this torsion kind of force up your leg, you're going to have perineal pain. We look at everybody from like bottom up, top down. Like your jaw tension, your like TMJ tension, your strap muscles in your kind of like mouth and neck area, all of that associates with the pelvic floor. So if you are a jaw cleaner, then you might have a tight pelvic floor. Absolutely. So the body is very connected. It's connected not just that way, but there's fascial lines. There's so many different ways that connect it. So a good pelvic floor PT will kind of do an external assessment and say like, okay, we talked a lot. Now I'm going to assess all of these different things and kind of see like, what does your posture look like? What's your muscle strength look like? How do you walk? And we're really looking at your goals. So if you're coming into me and you're saying, I leak when I run long distance, but not until I'm running 6 or 7 miles, is a different kind of assessment than I leak when I cough or laugh and I don't leak any other time. So we're looking at kind of putting all these pieces together. I liken it to like the Sunday New York Times crossword puzzle, is that we're just like taking all of these clues and making it all fit together as one. And what you're looking at is the kind of, I'm trying to figure out how I say this in the best way. You want to spend a lot of time with your pelvic PT, and some of that time is often doing internal. So that means that we don't use a speculum, we don't use stirrups, there's a gloved hand, single digit, but we assess those muscles just like we would any other muscle and say, are they weak? Are they strong? Are they tight? Is there too much length to them? Are you showing signs of potentially having a pelvic organ prolapse? Like, what's this whole system? Are your tissues thin? Are they well lubricated? Like all of these different things. Very consent oriented. You're covered in sheets. Yeah. It's not like you're just spread eagle out on a table. And then there's different modalities or ways to treat this. Sometimes when people are very tight and they have painful sex, or they've been holding their stress in their pelvis, then that's when we would indicate that something like a wand or a dilator set, depending upon what's best for you and what we prescribe, is, we would teach you how to use that. That's not something that I would say, go buy online. And, people would use it wrong. And sometimes that means doing pelvic floor contractions. Sometimes that means like, nope, we're not going to do those right now. Sometimes it's a lot of different core work or breath work, increasing the range of motion and mobility in your hips. There's so many different things that go into this. But you want to look for somebody that has a lot of manual therapy certification. You don't want to just go and lay on a table and do Kegels for 30 minutes. Like, that's not productive. We're adults here. We can do those things at home. And you want somebody to really cue you through these things. So you might spend some time in a gym-like space, like on a yoga mat, or doing different exercises depending upon how you're progressing in the exercises. You want to have a lot of education. You want somebody to show you that pelvis, like demo it, and with a pelvic floor model. And you want to learn about what's going on. We have autonomy. You want to figure it out and be taught that. And then you want to have stuff that you can do at home. And then you want to be able to see your pelvic floor therapist a handful of times. And that's different depending upon what you're coming for, and say like, oh, this is what we're doing together. I'm seeing progress. I'm seeing that I'm going to the bathroom less frequently, or I can run further without leaking, or I used to wake up 4 times in the middle of the night and now I'm waking up 1. So that's how we're kind of measuring that progress, is how are you returning back to your full function and abilities? Gotcha.
That's great. Yeah. No. When someone like you is practicing this, I knew that it couldn't be scary, but when, even for me who researches some of this for a living, I'm like, how does that work? And I feel like when I'm talking with a possible ghostwriting client and they're like, what should I be looking for in a writer? I say you want their credentials, but you want somebody that you really click with too. I feel like there's really got to be a sense of this is somebody that I can bear my greatest vulnerability to. 'Cause I feel like, when we study, I'm curious if you subscribe to this at all, but different books that I've read over the year, I remember, decades ago, Anatomy of the Spirit by Carolyn Mace, and some of these more spiritual, how this was kind of before RFK and the whole era that we're in now, my God. But Carolyn Mace talked about how for a woman, the pelvic region, she said is the power center of the body. And for people who, some people who have problems in this area, it might indicate, trauma at some point in their lives, where their power has been betrayed, or I think I might not be articulating this absolutely correctly. It's been a long, long time since I've read a lot of this stuff, but somebody who gets a lot of UTIs and stuff. I don't know. I just always thought it was interesting that it could be somebody who just has felt like they've had to fight for their personal power. When you start to talk about that tension. You've educated me just when you're if you're sitting all the time, doesn't even necessarily mean that it's getting weaker. I'm a really, really intense worker. My husband will walk into the room and he's like, will you please straighten up? He can feel the tension just from the way I'm hunched over in front of the laptop. So I really wonder if in fact, it's maybe not that it's getting lazy down there, but maybe it holds a lot of tension for me. And that's why I've been experiencing a little bit of dysfunction. What are your thoughts on that? What's that?
That's what I would tell your listeners. That's what I would tell your listeners, Chrissy. So, when you're in a great yoga class and they're relax your jaw and now drop your shoulders, and you're I didn't even know I was holding my shoulders up on my ear. Now that you tell me to relax, I can do that. So I want everyone to take a deep breath and think about, are you clenching your glutes?
I just when you asked that, I was I actually am right now. Yeah.
So those guys are friends and neighbors. So when you're squeezing your glutes or your hip adductors, which are your inner thighs, when you're squeezing all that, think about a little kid who has to go to the bathroom. What do? They cross their legs. It's because those muscles are all sort of connected. And so there's this hyperactivity. So if you're really wound up like that, then that can increase tension in your pelvic floor. And so, we don't want to walk around like a pile of mush all day, but a lot of people, stressful driving situations, just the stress of our world right now, they find that they're clenching a lot. And so we want to make sure that we're not doing that. We're telling ourselves to relax. And sometimes just getting up and walking around and moving around helps with that. But no, just because you're not just inherently falling to a pile of mush because you're sitting in a chair all day. It could be that you're getting stiff, you're tight. And to go back to what you said about the spiral circle, I mean, historically, over centuries, people have thought about, we go from like the sacral chakra to, the spiritual connection. There is, just because you have, so it's not an if then, just because you have pelvic pain or tension doesn't mean that there's some hidden trauma that you need to go searching out. But there are people that have experienced trauma or a sexual experience without their consent that have pelvic floor tension and that seek us out for care for that. Because it's all operated by your sympathetic nervous system, your fight or flight. And so if you've experienced a sexual experience without your consent, even if you're with a consent-oriented partner, you're having consensual relations, you want to do that, sometimes the programming in your brain, not for everybody, but sometimes your pelvic floor muscles will just like tighten and be like, nope, like I'm not doing that. And so that can be retrained. And that's where we often collaborate with people's therapists or their psychiatrists or things like that. But there's kind of an old saying that your pelvis holds your drama and your trauma. And there's a lot that weaves into that, right? Because it's holding our very important pelvic organs. It's attached to our breath. It's like it's part of our whole system. And I think it's been such an area that's been surrounded by shame. Like we learn about every part of our body. About it. Oops, stop there. Don't talk about what. Yeah. Talk about it. Like, Gen Z is learning how to use like tampons very differently than our generations did, where there was just like a to the bathroom and it was like, figure this out on your own. And so, I mean, now you can buy a vibrator
Sephora,
Anthropology or Free People. Like it's the shame is, it's self-care, right? And I think that's great for people. When it's done in the right way, like we should always be using like lubricant, etc. But now there's so many more options and that shame is being dispelled. That stigma is going away, which is great because the more that people know about their bodies, the more that they can identify to the appropriate medical practitioner when something has changed.
It's so true.
It's like doing a skin check or a self-breast check. Like if you know what you look like down there, take a hand mirror, check it out. Even if you don't like to look like, if you're pregnant and then, or at any stage in your life, and then not right after, but a couple weeks after you have a baby, you can look again and be like, this is how things are changed. This feels different to me. This looks different. My tissue looks like it's thin. The coloring is changing a little bit, like, which is indicative of blood flow stuff. So, we gotta know that part of our body. Just
I love that. I want to apologize to you and to listeners for the noise. They usually do not do our landscaping at this time of the week at all, which is why I tape on this day. But sorry about that. It's interesting that you say that, though. I have an OB-GYN friend back home in PA, Dr. Kelly Snyder, and she explained it to me one time. She said, we should be doing breast self-checks, not even necessarily like to be searching for a lump, but to know what's normal so that if anything ever does change, you're familiar enough, like that wasn't there before. And you're saying pretty much the same thing. I think that's wonderful. And you're so right that when we talk about like buying, vibrators at Anthropology and Sephora, it's like, man, we made it so bad. We made it so bad. And we're seeing so much of this in our society right now with like people, like when it's suppressed, it's going to come out in a different way. And it's better to just be educated and self-accepting.
Well, because your pelvic floor isn't like this. It's not like porn, right? Like we're not,
it's your health.
It's like a natural part of our body. Yeah. And when you can start noticing changes in bowel movements, in how frequently you're voiding, how much you're voiding, are you dribbling a little bit when you finish going to the bathroom? Are you waking up more at night to go to the bathroom? Does sex feel different? Like, it's a little uncomfortable? Do you feel drier? Or, do you feel like your orgasm is just like not as punchy and powerful as it used to be? Like these are all signs of like a little bit of weakness. Maybe there's a deep depletion of estrogen, like different things like that. So it's something that we shouldn't just turn off and shut out and say like, well, this is just for the bedroom and the bathroom. It's something that we should be thinking about and talking to, as we raise our children and things like that, to use appropriate anatomical terms, talk to kids about it, etc.
I'm going to go back to a point that we didn't get to cover. And again, I'm not necessarily asking you to go in depth, but when it comes to paying, like what should patients expect? Are they going to pay cash? Can it be billed to insurance? Typically, it just varies.
Very different. It's different.
Okay.
It's different everywhere. So some are cash-based practices. And the history of that is that since the 80s, CMS, or the Center for Medicaid Services, what they establish is like the going rate is pretty much what other large insurers follow up on. And then the bigger the practice you are, so if you have 100 locations versus 2, with more locations, you can negotiate different rates. There's also now large pelvic floor physical therapy practices or chains that, there are 30 or 40 different locations, and they are actually owned by, like there's one that's owned by Blue Cross Blue Shield. And so in some cases, you will pay your copay and then meet up to your deductible. It is also different. Are you being seen at a hospital? Are you being seen at an outpatient, like within a hospital, as a private outpatient? There's so many different, how long are you being seen for? What I would say is that you need to find what's best for you. Sometimes you get what you pay for. And just because you try one person doesn't mean you have to stay with that person. Yeah. You can try somebody else, whether it's within the same practice or a different practice. We offer what we call like courtesy billing or reimbursement. So we take the initial payment from clients, and people can use their HSA or FSA cards, et cetera. And then we give them or the insurance company all the coding and stuff so that people can be reimbursed. There's also telehealth options for pelvic floor PT for people that are unable to access it or in more rural areas. There are non-pelvic floor PT like devices that are hitting the market to try to do some strengthening. I'd be a little bit more cautious about that, but there's a lot of different options because there are a lot of different kinds of people out there.
Why? So,
but it doesn't always have to be.
Yeah.
What I used to tell people is that I am so good at what I do, and I've set up such a great sort of practice in how I work with people that you might have to see me 4 or 5 times. But if you were to see somebody else and they were like, come twice a week for 12 weeks, the cost between your copay and meeting your deductible, it mashes it. But what's the value of your time?
And getting better.
And there's a lot of different things of looking. Getting better. And it's not accessible to everybody. And I acknowledge that. And I'm now moved into a lot of like, how do we impact many communities for a lower cost structure? And that's a whole nother conversation, but we want to make sure we're not gentrifying healthcare. But the average person, there are now, 10 years ago, there would be like very few people to choose from. Now there's many more options.
What are 3 habits that you might, it doesn't have to be 3. What are, I don't know, even just one, like, are there any habits that you just wish people were a little bit more aware of that they could implement in their lives, to maybe make their pelvic health just a little bit improved or more optimal?
Yeah. I would say move your body, whether it's Pilates, yoga, walking, having sexual intercourse. Moving your body is great for your pelvic floor. You're getting blood flow to the area. You're preventing muscle atrophy or thinning. There's a lot of different things. The other thing is that it may seem nuanced, but there are a lot of things that we ingest that can aggravate your bladder and contribute to overactivity or incontinence. And it's the fun stuff. It's like sparkling beverages, things with artificial sweeteners, sodas, iced teas, caffeine, and alcohol. So those things irritate the lining of the bladder, and it's like, ooh, I need to go. And so for those of us that love the sparkling water and drink it all day long,
I'm really, that's so interesting. Oh my gosh, that's amazing, because I'm very picky about what I'll drink. I will, I really want, like, I have it right here, Spindrift. Like, this is my seltzer water, but I have at least one every afternoon. So that's really helpful to know. And I am a coffee drinker.
And so when you start the day with a coffee or a latte, and then you're moving over to like a Spindrift, and then you might have like half a glass of wine in the evening, like those things can irritate your bladder. Doesn't mean you need to cut them all out, but you should be aware of that, so that if you start to notice changes, you're like, I should
make my coffee a little bit weaker or something, because I
bit.
take it very, very strong. I'm notorious for that. Yeah. Oh yeah.
The third thing that I will say is that bowel health and your bowel habits impact your pelvic floor greatly. So when you're going to the bathroom and having a bowel movement, having your feet elevated, something like a stool or a squatty potty or a couple of dictionaries, if people still have those around, throw them under your feet, knees higher than hips, and you want your mouth open and you don't want to bear down, because that puts so much pressure on your pelvic floor. And if you're bearing down with your mouth open, you're actually closing your pelvic floor muscles, which makes it actually harder to have a bowel movement. So we want to get moving, watch what we're consuming. And those are small changes, like maybe 1 less sparkling water a week, 2 less a week, save you on your budget anyways. And then number 3 is poop in the right position. Mouth open, knees higher than hips.
That brings me back to a point that you brought up earlier that I'm like, I'm so fascinated between where you talk about like the jaw, the neck, the chin. What did you call the strap muscles? Is that what you call these? So I say this with love about my mother, who, like, we both struggle with this, and I see myself very much. And my husband even said just within the last year or two, like my mom started to develop around my same age, like the double chin. I see that my own neck is getting, like, I didn't have like this thing before. And even like I used to, well, I also had a lot more time when I was younger, and I don't think I was near the runner that you are, but I was a very regular runner and used to lift a lot. I'm still really, really active, but like work and miscarriages and being turning 40 as all of this was happening, like I piled a lot of weight on, but I saw the shape of like, it just used to be so much more defined. How might that be like, what might that be telling me or anyone about their pelvic health?
I think the like laxity and the like changes that you're seeing are due to gravity, your genetics, like how's your collagen and your soft tissue, part of the physiological processes of aging, stress, what's your lifestyle like? It's probably less indicative of pelvic floor. However, if you are grinding your teeth, chronic gum chewer, you feel that like tension in your jaw muscles and your cheeks, you feel like you're always like kind of developing like a little bit of lockjaw, that can contribute directly
in what
to your pelvic
ways?
floor.
Tight there.
If you're tight here, you're going to be tight there.
Oh my, this is so cool.
In a lot of cases.
Yeah.
I mean, nothing's like a full wash of like prescription, but they're very connected. And so also, if you think like, I'm going to do this right here, give you a little profile. If these are the strap muscles here, and if I'm sitting at a computer at my desk on Zoom or typing all day, and I'm like this,
that's what's happening.
That pulls that. And so, we really, you don't have to be fully erect all the time, but thinking about like, how can you move your body? How can we strengthen our shoulders and our back and our middle back, especially women over 40? Love cardio. I'm a distance runner. I wish I never had to lift weights again. Once you are over 40, you should be lifting heavy weights more than you're doing cardio to keep your physiological system.
What do you consider heavy weights for women?
Ooh, that's a great question. There's a very, very well-educated author, and, she has an influencer role now, is Stacey Sims. And she is great at talking about postmenopausal exercise. And she's one that I would go and check out and follow. But heavy weights is, we used to learn, like to get the like 90s, early 2000s was like, get your 5-pound weights and do like 20 reps with those. Now we want to lift heavier weight with lower reps. So maybe you grab that 15-pound weight and do it 10 times or 5 times. We want to like really work on, and that doesn't mean you're bulking up, but it's really helping prevent that depletion of muscle mass as you age. It's also really great for bone health.
I love that. Awesome. A couple questions as we outro here. I'm starting to ask these to all of my guests. Personal question. What's something you worry about less now than you used to?
Love the laundry that's sitting in the dryer.
It's good. Nope.
You just can't. I think it's just natural as you age. I think it just keeps getting better, but I worry far less about what people think about me or what, things like that. But it's like letting go of some of the small stuff, like the laundry sitting in the dryer, or I know the dishwasher needs to be unloaded, or, like different like day-to-day things.
I'm like, hey, she's a doctor. She owns a practice. She founded another practice. She's an author. You know what? Those expectations I have realized in the past few years, like also, there are days like I have my makeup on. I'm like, my makeup looks dumb in this light. It doesn't even look great, but like we go to all these lengths. I actually put a few curls in my hair today. But there are days when I'll record myself or I'll do something on social and my mom or my husband will say, why didn't you put makeup on? And I'm just like, because if I get so caught up in those expectations and looking perfect, or like you say, like having the perfect house, then I'll never do the podcast, or I'll never post that post, or I'll never have the friend over if I wait till the house is perfect. Like we've got shit to do, and
there's true trends. The from what I've been following in communication and news and media
Yep.
is that the trend now
Yes.
is that people want to see more authentic
Yeah.
stuff on social
Yep.
media. They're more drawn to that. And what I always tell people is like, great, I've won all these accolades, I've done all of these things. But what you don't like, I don't record myself like
Yeah.
crying after a long week or like covered in mud out back trying to figure out how to solve a problem. Like, you know,
Yes.
it's an iceberg.
Yes.
You only see this one little part of it. I'm the first to admit that I am human, but we're all heading towards somewhere. Okay, you said you had a couple questions, so I'm not worried about the laundry in my dryer.
My last question
What's
is,
next?
What's something that always makes you feel better?
Oh, there's a lot. My go-to is gardening or reading. Because usually if I'm feeling not well, I need to ground myself, center myself, and spend some time alone. It usually means I'm like headed towards burnout and I need to really have some me time. And so by doing those things, that really kind of settles me in. I think women, especially in our generation, you and I are very close in age, we're never taught to rest. And rest feels like this gossamer thought that it's really hard for us to think about, like, with all of the things that we have to do. And, you know, the side hustle and that we're taking Spanish classes on the weekends and all these different things that we're doing.
Yeah.
We're not taught to rest. And so I really love to spend some time. I'm a huge reader. We have that in common. And then gardening.
You know, when we report on centenarians, like multiple studies have shown that across cultures, the one thing that many people who live to 100 or beyond have in common is that they garden. And I believe, you know, that we talk about like the earth's electric charge and but you're right, just getting grounded and the physical activity part of it. But man, like I'm just, you know, I did yoga in our garden this morning and I'm a different person when I rise from that mat 45 minutes after I start, you know, just being in nature. That's so good. This has been, what are you reading right now?
I am reading the Stoneyard Devotional. It's by, I read on a Kindle, so don't ask me the author. She's an Australian author, but it's about, loosely about grief, in a beautifully written way. So that is what I am reading. And then I have some, what I call like my brain candy, like chicklet that I got to use on Libby before it expires.
Nice. Soon. You need that. It's true. Rest. And it's nice. The summer is a good chance to say, I'm not available. So this has been awesome. Thank you. Thank you for being available. Oh my gosh, this has been wonderful. Where can listeners find you?
You can find me on social media at Dr. Sam DuFlo. Also very active on LinkedIn in more of an advocacy way. If you're in the Maryland area, I own 2 rabbits, physiotherapy, and I still see clients a couple days a week.
Thanks, Dr. Sam DuFlo. It's been really awesome having you here. This has been a lot of fun.
Thank you so much, Christy.
Have a great weekend.
Wonderful to be here.